Hello everyone. Here I am going to talk about the anatomy of third ventricle and internal capsule. Here this is the median sagittal view of this left cerebral hemisphere. This is the frontal pole towards anteriorly. Here this is the occipital pole towards posteriorly. This surface here, this is the medial surface. This is the supromedial border. Here the center, you can see this is the corpus callosum. Here this is the genu, body and splenium of the corpus callosum. Here this is the rostrum. Here this is the anterior commissure. These are the columns of the fornix. So this is the body of the fornix. Here there is the crest of the fornix. The part of here, this is the septum pellucidum that is removed. So you can clearly see this is the lateral ventricle. Then here this area, this is the thalamus, anteroinferior to that. Here this is the hypothalamus. So there is a gray matter. Here this is the midbrain, pons, medulla. This is the cerebellar hemisphere. This cavity is the fourth ventricle. Here this is the cerebral aqueduct. Then, so this cavity of this diencephalon, that is the third ventricle, that is the thalamus here, this is the hypothalamus. So the cavity of the diencephalon here, that is called this third ventricle, this one. So we can see there are the right and left thalamus. Okay. Then there is the one here, the hypothalamus. So slit-like cavity between these two thalami, this is the third ventricle. Okay. You can see here this cavity is the third ventricle. Actually this is the lateral wall of the third ventricle. There you can see the thalamus with this hypothalamus. Then this lateral ventricle communicates with this third ventricle through one foramen here. This is the interventricular foramen of Monro. Then this third ventricle, this cavity communicating with this fourth ventricle through the cerebral aqueduct. Okay. Then about the boundaries of this third ventricle, here you can see this is towards anteriorly, it's posteriorly, this is superior that forms the roof, this is inferior that forms the floor. Okay, then this is the lateral wall. Then anteriorly, you can see this is the anterior commissure. These are the columns of this fornix. Then this is the lamina terminalis. Then this is the optic chiasma. This forms the anterior wall. Then posteriorly, you can see this is the pineal gland. Here this is the pineal gland. It has a superior lamina. This is the inferior lamina of the pineal gland. Then the inferior lamina has the posterior commissure. Then there is the commencement of the cerebral aqueduct. This forms the posterior wall. Coming to this floor, you can see anteriormost, this is the optic chiasma. Then this is the infundibulum. This is the mammillary body. Here between those areas, that is the tuberous cinerum. Here this is the posterior perforated substance. This is the tegmentum of the midbrain. This forms the floor. Then here comes the roof. Roof, you can see this is the thalamus. This is superior surface of the thalamus. Between the superior surface of the thalamus and this fornix, you can see a fissure there. That fissure is called the choroid fissure. There you can see the choroid plexus. So here, this is the choroid plexus. Okay. This cavity is lined by these ependymal cells. So the roof here relates to this choroid plexus. Then lateral wall, that is the thalamus. Two thalami connected through this interthalamic adduction. This is the gray matter. Then inferiorly, anteroinferiorly, this is the hypothalamus that forms the lateral wall. So this is about this boundaries of this third ventricle. Then additional to that, the prolongations of this third ventricle, those are called the recesses. You can see here above this optic chiasma, here this prolongation, here like this. Okay, so that is the optic recess. Then between this interventricular foramen and the anterior commissure, here this prolongation here, this is called the anterior recess. Then pineal gland, superior lamina, inferior lamina, between here this prolongation, that is called the pineal recess. Then above the pineal gland, here above the superior lamina, this area here will get the pineal recess. Then here this is the infundibulum. This prolongation here, this is called the infundibular recess. So that's the recess relates to this third ventricle. Then the choroid plexus here, I already told, you can see here it relates to this roof. This is the choroid plexus. So you can see this is the pia mater, okay, which covers this brain, closely attached. This is a thin transparent membrane, okay, which covers all these irregularities like this sulci and this gyre, okay, here. So this is the pia mater. So this pia mater here, which one is going to this choroid fissure like a double layer fold. Okay. Then in this pia mater you can see there is a fringe of capillaries. So that is from this anterior choroidal artery. Then this cavity here is lined with this ependyma. This togetherly forms the choroid plexus. So this choroid plexus here is going to this lateral ventricle also. This is common for this lateral ventricle and this third ventricle. You can see the choroid plexus here. It is common to this third ventricle and this lateral ventricle, which secretes the cerebrospinal fluid. Then here in this figure you can see this the diagrammatic representation of this third ventricle. So the anteriorly you can see this is the anterior commissure, lamina terminalis, optic chiasma. This is the corpus callosum superiorly. Here this part is the fornix. Here you can see this is the septum pellucidum. Then here you can see this is the pia mater. See, this is the pia mater, this fold here. Here we'll get the choroid plexus. So that forms the roof. Here you can see this is the lateral wall. There is the hypothalamus, it's the hypothalamic sulcus. Here this is the, this is the thalamus, this is the hypothalamic sulcus. So here we'll get, this is the hypothalamus. Then floor, you can see this is the hypophysis cerebri, the infundibulum of the hypophysis cerebri here, that forms the floor. Then behind this is the mammillary body. This area is the tubus cinerum. Here we'll get the posterior perforated substance. This area is the tegmentum of this midbrain. Then posterior here, the posterior wall is made up of here relates to the pineal gland. Then the inferior lamina. The inferior lamina contains this posterior commissure here. Then the commencement of the cerebral aqueduct. This forms the posterior boundary. So that's about the boundaries of the third ventricle. Then coming to the circulation of the CSF, we have seen the features of this lateral ventricle. This is towards anteriorly, this is posteriorly. This is the median sagittal view. You can see the corpus callosum. This is the lateral ventricle. The third ventricle, you can see the choroid plexus of this lateral and this third ventricle. Fourth ventricle here, this is the choroid plexus, which secretes this cerebrospinal fluid. Okay, so this one. So the majority of the cerebrospinal fluid, some 80 to 90%, okay, is forming in this lateral ventricle. From this lateral ventricle here, this communicates this CSF is flowing to this third ventricle to this interventricular foramen of Monro. From the third ventricle here towards the fourth ventricle, here the communication is through this cerebral aqueduct here. From this fourth ventricle you can see here is continuing through this central canal of the spinal cord. Okay. So majority of the CSF from this fourth ventricle is going to the subarachnoid space. You can see the subarachnoid space here. It relates to the brain. This is the cisterna magna. This is the pontine cistern where the pia mater and the dura mater are large, and so the subarachnoid space is large. Okay. The space between the pia mater and the dura mater are large and forms this one cisterns. Okay. Cistern here relates to the cerebellum. This is the cisterna magna. It relates to the pons here. This is the pontine cistern. So the CSF is there in this fourth ventricle. From there, you can see there is a median aperture that is called the foramen of Meninges. It's the CSF is going to the cisterna magna. Then there is a lateral foramen that is called the foramen of Vleska, two lateral apertures. Then the CSF here is flowing to this pontine systems. Then here it's reaching to this subarachnoid space here, subarachnoid space of this brain. Then, so subarachnoid space you can see between this arachnoid matter and the pia matter. So here this is the cortex of this cerebral cortex. So this is the pia matter. So this is the arachnoid matter. Between the space here, this is called the subarachnoid space. Outside this arachnoid matter, there is a dura matter. Here you can see in the lower area, this is the spinal cord. Okay, so this is the pia matter. Here this is the arachnoid matter. So the space here, this is the subarachnoid space. Okay, so here, so this brain here and the spinal cord is floating in the subarachnoid, this one floating in the CSF. Okay, so this brain here and the spinal cord is actually floating in the CSF. So the weight of the brain gets reduced. Okay, so this average here, the weight of this brain, that is the 1400 grams. Okay, so due to this floating of this brain in this cerebral spinal fluid, it gets reduced to 50 grams. So you can feel only this 50 grams. Okay. Then coming to this absorption of the CSF. Okay. Here you can see this is the meninges. So this is the skull. So here this is the dura mater, outer layer of the dura mater. This is the endosteal layer. You can see there is a venous channel is there. This is the inner layer of the dura mater, that is called the meningeal layer. Okay. So wherever the venous sinuses are there, this outer and inner layer gets separated and forms between these two layers. There is the venous channel. Here it's lined with endothelial cells. Then inner to this dura, you can see this is the arachnoid matter. It has these trabeculae there, trabeculae. This is the pia matter. This is a part of the cerebral cortex. Okay. So the space here, this is called the subarachnoid space. It has projections. These are called the villi. The villi group to form this arachnoid granulations. Okay. So you can see this arachnoid granulations. Okay. So the CSF in the subarachnoid space, it gets absorbed through this arachnoid granulations, then to this superior sagittal sinus. Okay, this is the superior sagittal sinus. So CSF here is absorbed back to this venous blood, that is to the bloodstream. Here you can see the meninges. So this is the coronal view of this through the skull. You can see this is the skull bone here. This is the scalp. Here you can see this is the cerebral cortex. So here this layer, this is the pia mater. So these are the membranous coverings, this connective tissue fibers. So this is the outer dura mater, a tough layer that is made up of fibrous tissue. This is the outer endosteal layer which lines this inner to this skull. Then this is the outer meningeal layer. So this endosteal layer and meningeal layer will separate to accommodate this venous channel. Okay, that I've called this dural venous sinuses. Okay, so this is the endosteal layer. This is the meningeal layer. You can see this is the venous sinus. Here this is the superior sagittal sinus. This one. Then this meningeal layer here forms dural folds. This is a folding of this meningeal layer, which forms the dural fold. Then here you can see this is a superior sagittal sinus. Okay. Then this is the arachnoid matter. Okay, this is a thin membrane. Here this is the pia mater. This is a thin transparent membrane here. This is highly vascular. The space here, this is called the subarachnoid space. These are the trabeculae there of this arachnoid matter. The projections here, these are called the villi. It's grouped to form this arachnoid granulations. So the CSF here is going to do this arachnoid villi, then gets into this bloodstream. Okay. Then, so the functions of the cerebrospinal fluid, here this is the protection, which protects the brain. Then buoyancy, that is reduces the, gets which helps to reduce the weight of this brain. Then there is through the excretion of the waste products. Then the volume of this CSF, that is the average here, that is the volume is 150 ml. It constantly gets replaced. Then here you can see the accumulation of the CSF in these ventricles due to the narrowing of these communications. Okay, so the interventricular foramen of the central ventricle, and also there is this tumors of this surrounding tissues which also compresses these ventricles. So there is the accumulation of the CSF in these ventricles. That condition in these children is called the hydrocephalus. Okay, sometimes it is congenital. Okay, here how to find out the cause of this hydrocephalus, and it is treatable. Then here you can see this is the cisternal puncture or this cisternal tap. Okay, so the CSF here can withdraw from this subarachnoid space. Okay, for this diagnostic purposes and all. One procedure, the commonly used procedure, that is the lumbar puncture. Okay, here you can see this is the cisternal puncture means. Okay, this is the cerebellum here. Here you can see this is the medulla here. So this subarachnoid space, this is called the cisterna magna. Okay, so needle is inserted through this posterior of this foramen magnum, and also here to the posterior of the first cervical vertebrae here. So you can see the subarachnoid space. This subarachnoid space is comparatively larger. This is called the cisterna magna. From there, this CSF can withdraw, and for this, it will be useful for this diagnostic purposes and all. Then here you can see this is the lumbar puncture or the lumbar tap. Okay, this is the usual procedure to withdraw the CSF. Okay, from this lumbar area. Here this is the L3 vertebra, this is the L4 vertebra here. You can see this is the spinal cord. The spinal cord usually terminates at this between this L1 and L2. Here this is the L2. The spinal cord terminates, but there is the prolongation of this dura and this pia mater till the level of S2. Okay, so here the space here, this is called the subarachnoid space, is larger here, and this is called the lumbar cisterns. Here the lumbar puncture is usually done between this L3 and L4. Okay, to withdraw the CSF. So here it's no need to worry about this getting damaged to the spinal cord, because it's already terminates at the level of this L2. Okay, so this is the safest procedure. The patient has to flex. Okay, flex completely. Okay, either can sit or can lie down. Okay, to flex here. So this is the lumbar region between this L3 and this L4. This is the lumbar cisterns. Okay. So CSF can withdraw from this area. So that's about this lumbar puncture or this lumbar tap. Then, so here we have seen this third ventricle boundaries, then the circulation of the CSF, then its absorption of the CSF into the superior sagittal sinus. Then we'll see the gross features of this internal capsule. Here again, here this is the median sagittal view of the cerebral hemisphere. So this is the frontal pole. So this is the occipital pole. This is the frontal pole towards anteriorly. Here this is the temporal lobe. This is the supromedial border. This is the medial surface. Here you can see this is the corpus callosum. See, this is the splenium. This is the body. Here this anteriorly, this is the genu. They made a cut through this. Okay. Okay. So here this is the hypothalamus. hypothalamic area. This is the cavity here. This is the third ventricle. So this is the lateral ventricle. Here this is the thalamus. They made a transverse cut, okay, through like this, and we can separate these halves. This is the upper half and this is the lower half, okay. So this section here, this is the horizontal section. So in the horizontal section we can see the internal capsule clearly. So this is the lower half of the lower half. This is towards anteriorly. Here this is towards posteriorly. Yes. So this is the one half of the cerebral hemisphere. Okay. So this is the right half. That means towards anteriorly. This is towards posteriorly. So this is the right half of the cerebral hemisphere. They made a transverse cut like this. So this is the longitudinal axis. So we can separate this upper half and the lower half. Then we are going to explain the internal capsule in terms of the horizontal section of this lower half. So you can see the two halves here. Then this is the lower half. Then this is towards anteriorly here. This is towards posteriorly. Here you can see this the cerebral cortex. Okay. This one is the genu of the corpus callosum. This is the splenium of the corpus callosum. So these are the white matter here. This is the white matters. Okay. So here these are called the corona radiata here. These are the white matters of the cerebrum. Then you can see this is the anterior horn of the lateral ventricle. This is the posterior horn of the lateral ventricle. Here we'll get this is the thalamus. Here this is the caudate nucleus. Then between this thalamus medially and the caudate nucleus, you can see there is a white fibers are there. So here these white fibers, these are the internal capsule. Then lateral to this internal capsule, you can see again there is a gray matter here. This is the basal nuclei. The gray matter here, it appears in this darker in color. So again this gray matter, this is the basal nuclei. So this white matter here, these large projection fibers, okay, from the cerebral cortex, then going to this lower areas, and also these concerns of afferent and efferent fibers there. So these is the internal capsule. Here the concavity of the V is directed towards laterally. Between here medially, this is the caudate nucleus and this one is the thalamus. So that's about the internal capsule. Then about the parts of the internal capsule, here this is the horizontal view. This is a transverse section through this cerebrum, that's through the level of this thalamus. You can see this is towards anteriorly, here this is towards posteriorly. You can see this is the caudate nucleus. This one is the caudate nucleus. This is the anterior horn of the lateral ventricle. This is the thalamus here. It's thalamus. This is the posterior horn of the lateral ventricle. Then here this is the lentiform nucleus. It's the basal nuclei. Then in between these we'll get a V-shaped structure. Here this white matter. These are projection fibers. This is called this internal capsule. Okay. So here in the left side, here left half, this is the internal capsule. In the right half here, this is the internal capsule. So this internal capsule has an anterior limb. This is the anterior limb. This bended part, this is the genu. This one is the posterior limb. Then the posterior limb here is continuous here. This is the retrolentiform part. Then there is a part which lies going behind this lentiform nucleus, that is the sublentiform part, that is not visible here, with the sublentiform part. So these are the parts of this internal capsule. Here you can see this is the anterior limb. This one is the genu. This is the posterior limb. This is the retrolentiform part. Then a part going behind to this lentiform nucleus, that is the sublentiform parts. So these are the parts. Here, this cavity here, this is between this thalamus. Here, this is the third ventricle. Here, this is the anterior horn of this lateral ventricle. This is the posterior horn of the lateral ventricle. We can see the corpus callosum. This is the genu. This is the splenium. They made a transverse section. Okay, so that's the horizontal section. This is the horizontal section. Okay. Then, so again back to this diagram. Here, this is toes anteriorly. This is the frontal pole. Toes posteriorly. This is the occipital bone. This is the genu. This one is the splenium of this corpus callosum. You can see this is the thalamus, two thalami. This is right and left. This cavity is the third ventricle. See the third ventricle. This is the fornix. This is the anterior horn of this lateral ventricle. This is the posterior horn of this lateral ventricle. Okay, this is the splenium. These fibers here, these are the forceps major. These fibers here from this genu here, this is the forceps minor. This is the thalamus. Here, this is the lentiform nuclei. You can see this one, this fibers, white matter, this is the projection fibers. This is the internal capsule. You can clearly see this internal capsule. This is the anterior limb. This is the genu. This is the posterior limb. Here, this is the retrolentiform part. Okay. Then, about this fibers of this internal capsule, there are motor fibers, sensory fibers there. So, here, this is the head of the caudate nucleus. This is the thalamus. This one is the lentiform nucleus. Okay. So, this is the right half. You can see this is the anterior limb. This is the thalamus. The other side here will get the other thalami. Then this is the genu. This is the posterior limb. Here, this is the retrolentiform part. Here you can see this is the sublentiform part. Then, so coming to the fibers, there are motor fibers and the sensory fibers are there. So here there is the motor fibers, one group, that is the corticopontine fibers, okay, which originates from this cerebral cortex, then and is actually going to the pontine nuclei. So these are the corticopontine fibers. This comes under this motor fibers, corticopontine, that is from the cerebral cortex. Okay, and actually it is named according to the lobe from which they arise. So you can see the frontopontine, parietopontine, temporopontine, occipitopontine. Okay, so from the cerebral cortex, okay, from the respective areas, and is going to the pontine nuclei. These are the motor fibers. Okay, so the anterior limb, here this is the anterior limb. You can see this is the frontopontine fibers. Okay, then in this genu is not there. Then in this posterior limb, you can see there is also frontopontine fibers. Okay, in this posterior limb here is also frontopontine fibers. Then in this retrolentiform part, here this is the retrolentiform part. It contains parietopontine and occipitopontine fibers. Parietopontine and occipitopontine fibers that you can see in this retrolentiform part. Then in the sublentiform part, there will get the temporopontine fibers. That is in the sublentiform part will get this temporopontine fibers. So these are the corticopontine fibers. So this anterior limb here, in this posterior limb, you can see the frontopontine fibers. In this retrolentiform part, you can see there is the parietopontine and the occipitopontine fibers. In the sublentiform part, you can see there is the temporopontine fibers. Okay, here it's marked with these lines like this. Okay. Then additional to that, there are pyramidal fibers are there. The pyramidal fibers here which arise from the cerebral cortex and relate to the lower motor neurons. Okay, that is in this brainstem and this spinal cord. The pyramidal fibers here are of two types. There are the corticonuclear fibers. You can see this is the corticonuclear fibers. Then there is the corticospinal fibers are there. Corticonuclear and the corticospinal fibers. Okay. These corticonuclear fibers which synapse with the contralateral motor nuclei of the cranial nerves which innervates this head and neck muscles. Here you can see here. These are the corticonuclear fibers which forms this corticonuclear tract which innervates the muscles of this head and neck. Okay, here. Then the corticospinal fibers here which innervates this one, the muscles of this upper limb, trunk, then to the lower limb. Okay, that is the corticospinal fibers which synapse with the anterior horn cells of the opposite half of the spinal cord. Okay, here. So this is the pyramidal tract. Okay, here. Okay, that you can see in this posterior limb. The pyramidal tract of this pyramidal fibers. This is important. You can see in this posterior limb. Then coming to the sensory fibers. The sensory fibers here are called the thalamocortical fibers. Okay, you can see here this is the anterior thalamic radiation. This is the superior thalamic radiation. Okay, so the sensory fibers are called the thalamocortical fibers. Okay, which radiate from the thalamus to different directions. Okay, the anterior thalamic radiation you can see in the fibers of this which directs anteriorly and connects the thalamus to the frontal lobe cortex. Connect the thalamus. Here you can see the thalamus here to the frontal lobe. Okay. Then superior thalamic radiation, here it's directed superiorly here, and this fibers, here you can see this one, superior thalamic radiation. This collects, is going to this primary sensory cortex. Okay, the superior thalamic radiation is going to this primary sensory cortex. These are the actual sensory fibers which collects information from the somatosensory system passing through this posterior limb. Here this is the posterior limb. Here this is the genu. This is the anterior limb. So here the thalamocortical fibers which carries information from the somatosensory system passing through this posterior limb to this primary sensory cortex. Okay, so these are the actual sensory fibers you can see in this posterior limb. Okay. So that it forms the superior thalamic radiation. Then additional to that you can see this one here, this is the retrolentiform part. Okay, this one contains here this fibers to this occipital lobe, So these are the optic radiations. Okay, that is connects the lateral geniculate body. This is the lateral geniculate body here to this primary visual area of this occipital cortex. So this contains this optic radiations. Then here you can see this is the medial geniculate body here. So this medial geniculate body to this primary auditory area of this temporal lobe. Here the sublentiform part contains this acoustic radiation fibers. This retrolentiform part contains this optic radiation. Here these fibers. So that's about these fibers of this internal capsule. Here this is the anterior limb. Here you can see there is the thalamocortical fibers, that is the anterior thalamic radiation, and also there is the motor fibers here. These are called the frontopontine fibers. So this is the sensory fibers. In this genu here you can see the pyramidal fibers. These are the corticonuclear fibers. Then you can see there is a frontopontine fibers also there. Then here in this posterior limb, here the posterior limb, you can see there are pyramidal fibers. Those are the corticospinal fibers. Okay, here these are the motor fibers. Then additional to that, there are corticorubral fibers also there. Then here is also frontopontine fibers are there. Then coming to this sublentiform part here, sublentiform part here contains this one acoustic radiation. Then retrolentiform parts here, this carries here this optic radiation. Then additional to that, this retrolentiform part here contains this corticopontine fibers. Those are the parietopontine and the occipitopontine. Okay, so that's about the fibers of this internal capsule. Here we are seeing this parts of the internal capsule, then its fibers, then the relations here. Relations here medially, you can see there is the thalamus inferiorly, and superiorly there is the caudate nucleus medial. Laterally there is the lentiform nucleus. Yes. So the question is the formation, parts, fibers and blood supply of this internal capsule. Then you should know about this lumbar puncture also. That's all.